Good afternoon, Dr. Rollins. Today we have Dr. Rollins, Dr. Marlon Rollins. Very extensive bio. I'm just going to go over 5% of it right now. Dr. Rollins has a master's degree and a PhD in psychology, and he's an accomplished licensed mental health counselor. Dr. Rollins possesses a wealth of knowledge and experience, and with over 2 decades of experience in behavioral health care, he has become a prominent figure as both a captivating speaker and a published author. Tragically, over a decade ago, Dr. Rollins actually experienced a deeply personal loss when he lost his sister, Amber Rose Rollins, who was a compassionate nurse, after she battled her own struggles with mental health. Dr. Rollins has held esteemed leadership roles in prominent healthcare organizations, including United Health Services, American Addiction Centers, Acadia Healthcare, as both CEO and COO, and he's played a pivotal role in some of the largest psychological and psychiatric hospitals in California. Under his guidance, these institutions have flourished, leaving a lasting impact on the lives of countless patients and their families. So it's not often that we have somebody who's both dealt with this personal loss, he's a licensed professional in this field, and he's an executive. And so we're really grateful that you've spent your time here with us today.
Thank you. Thank you so much for having me today. I'm really honored to be here. Again, thank you for the audience and everybody who's tuning in. I'm hoping that I can speak some life and provide some insights, especially as we're coming to the close of Recovery Month and Suicide Prevention Month. Because again, we have a lot of work ahead of us, and as more that I talk with families and their loved ones, there's a lot of confusion out there. There's a lot of hurt, there's a lot of heartbreak, and we've got to get to a point where we're becoming more and more authentic as people and as providers, as people are seeking help. So I'm hoping that I can offer some insights, things that I've seen, things that I think that we still need to do as an industry to be better for our employees and for the clients and families who are reaching out to us. Because again, I've sat on all sides of it, and my goal, and I'm trying to take everything, all of my clinical experience, my professional experience, and put together a stronger, deeper, more meaningful purpose. I'm very proud now. I work as President and Chief Operating Officer with Renewal Health Group. We're located in Los Angeles. We do with Monteiro Behavioral Health. We do addiction and rehab with Sanctuary, Phoenix Rising, recovery out in Palm Desert. And also we have another program called Zenith in Arizona. So all focused on behavioral health. And I love being a part of this team. So I'm very proud of the work that we do. And again, I'd love to talk more about that. But also, again, like I said, I'm here to answer questions and just share what I believe might be meaningful to the audience. So feel free to ask anything. And again, I appreciate the listeners for tuning in today. And I hope you're well and that this touches your heart in some way today.
Well, again, thank you. And actually, I know a few people over at Renewal, including yourself, but you guys have a wonderful team, and everybody really cares about what they do over there.
Yes,
so,
yes.
Some of the topics I wanted to go over today, and I think you actually hit the nail on the head earlier when you said there's a lot of confusion out there. That's actually one of the goals of our podcast, is that we want to be a reliable source with trustworthy experts who are going to share information that can be something that gives people not only knowledge, but also the tools to be able to deal with these mental health and addiction issues. So, some of the topics, again, we wanted to go over men's health. You have a lot of experience in that. We wanted to go over suicide prevention, both as a clinician and also as somebody who's recovered from that or is recovering from that personally. And frankly, you as an executive and as a leader, a lot of companies are dealing with mental health and addiction and different types of issues that they never really had to at least acknowledge before. And it's become such a more prominent thing to talk about now. And so talking about, as a companies and employers and people that are in management and leadership positions, what can they do in dealing with these types of issues in the workplace? So I definitely want to go over all of that. Why don't we start, really you can start with whichever topic you want, but looking forward to hearing from you. Yeah.
Well, I think I'd like to start with the workplace, and then I'll kind of get into my own personal story. Okay. The workplace, I'd say, because again, I've had my share of adventures working with some of these big companies. A lot of them, put stars in your eyes. You have a lot of hopes and dreams of, oh, it's a big company and this is going to be great. And what I learned specifically coming after, 2020, being a CEO, leading a hospital through COVID, and then seeing we were essential workers. Right. So in spite of all the fear, the anxiety, people were struggling. Like, we were in the midst of an opiate epidemic, and then the pandemic hits, and everybody's asked to show up to work. And you're an executive, and you're leading your team to say, I don't know what tomorrow is going to look like, but now I know we have to keep showing up for patients who are seeking treatment. Now, after that, it was like this collective traumatic event that had happened across the nation. For everyone was impacted by it. And as people moved around, some people were exhausted by just the ongoing work and effort and the uncertainty, just the absolute mental fatigue that it took on therapists, nurses, management team, intake, your behavioral health techs. Everybody was scared. So now I have to just acknowledge that the workplace and the people who are coming in to look for jobs, looking for deeper meaning, looking for safer places, because we didn't feel safe. Right. So that really makes it important to make sure we had to, and myself had to step back and go, like, how do I want to lead moving forward? What do I need to create? Because this need is increasing. Our employees need help. So we have to design a workplace now that's safer, that's more thoughtful, that's more authentic, that is more courageous, and is more focused on the people who are providing care versus like, okay, execute and make sure that we're making, the bottom line, if you will. Because people don't respond to that. What I've learned is that people want a greater mission. So, it seems like we took that for granted. And what I mean is, in behavioral health and addiction care, we thought people would just show up out of goodwill. Oh, you just, it's taking care of people. That's noble. It's a noble cause. But what I learned, what's more important is not just what we do, but how we do it. That really matters to people, to make sure that your employees know that the way you make decisions, that you're putting them first, and it's not, again, just about making money, but we really do care. They want to be aligned with leadership. They want to be aligned with management that they feel cared for. And then beyond the how we do it is the why that we do it. Like, I need to know the reason behind why this is even important to me, right? So what I've learned is not only being courageous and being bold enough, but about, taking the next, innovation event. Let's do this now, but more the courage of being more vulnerable and looking inward. The courage it takes to talk about your personal story, right, and your personal why, and then let that why inform the how that you do things, and then what we do becomes even better.
Right.
The thing that differentiates the good providers from those that struggle are the ones that focus in on the quality of care and really focus on the patient experience. And now it becomes focusing on the experience of your employees, because there's a lot of choices. So you want to choose an organization, and the organization wants to choose people that have a deeper why, and they're going to do it with a how that has integrity, that's values driven, right, and being really clear on what that looks like, and then be able to execute at a higher level, because at the end of the day, the people are the organization. Right. So, I work in operations, so I try to create clear structure to help make sure everybody feels safe. So, I can say more about the workplace itself, but those are, I think, some key essentials that I think anybody in a management position needs to be paying attention to if you're going to be doing this work, because you can just pick it up and say, oh, it's a good business, there's high demand, people need mental health care, we need better access. But again, the people, the citizens, the family members, they're still looking, can I trust this place that I'm going to send my loved one to? And we have a responsibility to create that safe place that is not deceptive, that's honest, that has integrity, that will own its mistakes when they make them, to communicate clearly what those expectations are, and to help manage their anxiety as well. Addiction is not an easy disease. It never has been in mental health either. So anyways, that's really the responsibility that we have as providers
Right.
nowadays.
No, I mean, you exactly right. I mean, just from my own experience as well, this is one of the most challenging fields and industries to be in. It's obviously healthcare itself is a challenging
Yes.
space, but the addiction and mental health space, from an operational perspective, and just managing these facilities, and they're 24/7. There's no time off.
Right.
But you
Right.
still have to provide that peace of mind to the staff that they can take a break, and that the rest of their team, they can rely on them, because you need each shift to be able to rely on the other shift.
Yes.
And ultimately you're working together.
Mm-hmm.
But since the pandemic, there's been such a change in the workforce as far as the labor market, and that's not just our field, that's in every field. And so really looking for the person who is doing it for the right reasons, and is wants to grow, because that's their career path, rather than, okay, this is just a job that I need to do. Because you can't be successful in this field if this is just a job. It has to be your passion. There has to be a why, and there has to be motivation. So I think that's the most challenging part of what we do, is to go through that and ultimately cultivate that culture. But I mean, I couldn't have said it any better than you did. So, have you seen a change though since before the pandemic and after the pandemic in terms of attracting quality staff and retention of staff? And not only in our field, but have you kind of seen it, how it trickles down in other fields? And do you have any advice or suggestions for other employers on how they can do better?
No, that's great. Again, it absolutely has changed. I think from the workforce, people are more selective. They do want that time off. People are standing up for themselves more now, and they're more selective. They want more. They want better pay. They want competitive pay. They want to work for places that have purpose.
Right.
So I think those expectations has changed, as opposed to, are we going to hire you? Almost the power has shifted. Right now, the employee is saying, "Do I want to work for you?"
Right.
So that's switched. We have to be thinking like, listen, like we're in the vulnerable seat now, and how do I attract this employee to say, "Oh yeah, pick me"?
Right.
Which is unusual. Like, oh, okay, I'm a little uncomfortable now in that regard. So, and that's okay, because honestly, it challenges the administration. It challenges the hiring managers to work at a deeper level. So we have a greater responsibility. So one of the things I would advise, the administrators to do, is to be very clear about making sure you know what your mission is and know what your values are, and more importantly, define what those values are. It's kind of like, people's like, "Oh, I go to work, it's for, I want to work, we be a part of a family," but you want to be a healthy family. Sometimes
not a
dysfunctional family, because people have come from a lot of dysfunctional families in the workplace. So they're like, "Don't even say that word family to me anymore." But really, a healthy family, what does that look like? So having values, and just like, think about at home with your children, or whatever organization, or maybe it's a cultural thing. Like, our values are a set of behaviors, right? So do I sit down at the table and do I say a prayer? Do I get off my phone? Do I stand up and before I start a meeting, give recognition to the people in the room? Do we give celebration as we start things? Those things are behaviors that indicate values, right? How do we show up in the workplace every day? So again, defining those values, what they look like when we act. Do I say hello to you every morning? So making it clear, like, hey, this is what we do. Listen, we want to be a healthy family, so we say this, we don't say this.
Right.
If professionalism is important to you, and you're the portion that's coming, that's selecting a place that matches who you are, like, oh, I want to join that family. I want to become a part of who you are, because I feel aligned with that. Like, do I come in and wear flip-flops to work, or do I come in with a suit and tie?
Right.
So dress matters. I want to be a part of something that feels unique, something that's innovative. And so you should be able to clearly spell out what the workplace looks like.
Right.
Because as soon as they come in, they're going to say, did what you say actually show up in the workplace, or do I come in and it feels like all this dysfunction is happening?
Right.
And the only way that we understand it is going in and checking in on our teams and talking with them and seeing if they're okay, and communicating with them to make sure we're on the same page. What do you need? People need to feel cared for in the workplace. So again, I think doing a self-examination of you, the individual, and then also the workplace itself. What does it look like? What are employees saying? And holding people accountable within that, right? Because if somebody's over here doing something that's against our values, we need to say
Address
something.
it,
We need to address it, right? Because as a coworker, I can't do that. I'm expecting you to do that as my hiring manager.
Well, I'm sure everyone listening appreciates that. I personally not that I learned it, but it's about using these tools, right? Because I think what you said is, sure, we know that we should be nice and say hello, right? But we need to hear it from somebody like you because you've seen it and you know what the ramifications of not doing it are. We're so busy checking our emails, checking our text messages on our phone, our watch, and everything. And you walk into a room and you just kind of are oblivious of the fact that there was already something going on in that room. But taking that moment, that mindfulness and that thoughtfulness, I think that's really the takeaway here is that, just pause, go in, and just everyone else is a human being in there, right?
Yep, start there.
No, that's great. I think that if everybody did that and if all the employers and management teams did that, the employee retention and all that would go up the roof. I'm sure we'll do a study in a few years and the stats will prove that. I want to shift from the workplace, kind of going more on a personal level. On your bio, we mentioned the death of your sister, the suicide, and you also mentioned how deeply involved you are, both in your practice and just in your own kind of professional life and personal life, dealing with suicide prevention, and how do you really stop that and help families identify? What are the things that they should be looking for? So I'd love to hear more about your story and just the tools that you can give everybody in relation to that.
Yeah, no, thank you again. And again, it ties well into what we were talking about before when we're talking about creating the workplace. And the key beyond the next level of, like I said, the how, which is your values and your behavior, is your why. And sharing your vulnerability, sharing your story is so key because everybody has a story. And if you're going to be courageous enough to tell your story, share your story, it draws people in. People need to feel some sense of inspiration and to know a little bit at a deeper level what you've been through. So 10 years ago, in 2013, I lost my sister, Amber Rose Rollins, 2 years older than me, to suicide. And at the time, I was a director of an admissions department for a psychiatric hospital. I was a licensed therapist. It was a crisis center. She was a nurse, and she went through, we grew up together, 2 years older than me. We considered ourselves had kind of made it. We had went through a lot when we were younger, and we were kind of on this path to make life better for ourselves. So we had I was 31, 32. I was 31 when I got my doctorate, and this is 35 years old. My sister started going through a mental health crisis. She was struggling with addiction. We had lost our biological father, had died that year, so she was dealing with grief and loss. She was dealing with a divorce. Come about that she was then struggling with an addiction and was using drugs, essentially, to help cope with the grief and loss and some of just her feelings emotionally, the trauma that we had went through when we were younger, and it was coming to surface. And there was a point where I admitted her into the hospital that I was the director of. And now she came in willingly, but once she got there, she went from the nurse who had no history,
right,
no treatment. But then we found out when she was there, she tested positive for an opiate, and then she has to self-report to the board of nursing, which which turns into regulation. Her license is suspended, and now she has to go through this healthcare system to get her nursing degree or get her nursing license back.
Right. Deal with probation and
all that kind of stuff. Are you going to treatment? So she was that nurse, and people always say nurses are the hardest people to deal with in patients, and we've probably seen them in treatment. They come through and they're difficult because they know more or they want to challenge everything that the doctor says. My sister was that patient. She was an exceptional nurse. But again, her getting access to care, in addition just to the stigma of going to get help, getting treatment, being given a diagnosis. She was ultimately diagnosed with bipolar disorder, but also with the addictive disorder. And then feeling like mentally she just wasn't able to stop using, right? And then the medications that she was on, made her feel groggy and her mood was down, right? So it doesn't make you want to be the most compliant patient
Right.
when you feel like maybe the drug helps you better, but you haven't done, the therapeutic work underneath. So it was a struggle, and I was trying to be just the little brother. She's older than me, so I can't tell her what to do.
Right.
But sadly, by the end of that year, she ended her life, and it opened up my eyes even deeper. I went through a lot of my own pain and grief and guilt about what did I miss. I tried everything that I could to help her. She had a 13-year-old daughter at the time who was nearby, who was the first to find her, which was tragic.
Right.
Again, I do want to put out there, call 988 if you are having any suicidal thoughts. You can text help or home to 741-741. At the time, back in 2013, there wasn't a 988 number that just launched last year.
Okay.
And it was a 1-800-273-TALK was the number. And I was, soon after that, I was able to get on the steering committee, and we had this conversation about coming up with an N11 number. This is back in 2014-15. And we had discussions about the idea of making it shorter, but we didn't launch it at the time.
Right.
Not on the steering committee now, but I remember those conversations. We looked over data. We talked about the idea that nobody calls 1-800 number anything anymore, right? So it was antiquated.
Right.
But again, seeing my sister and having to now bury her, and then I looked back at her case just clinically and looked at the systems that she was in an IOP program, an intensive outpatient program.
Right.
And so she was getting help, if you will, but the help wasn't looking at her. Because I read through her notes. I saw that she was still struggling, after she passed away. And I was frustrated. And I would call the director back and I would say, listen, did you see? What did you do? What are you going to do differently now that my sister's gone?
Right.
Right? What's your responsibility? And some of the answers I got were like, it happens. I was like, wait a minute. This is my sister.
Right.
Right? And I used to work there. I had a place I used to work.
Right.
And that really compelled me to want to do something more, because I said, and I was still on this mission of I could somehow fix this. So we were in Indiana, that's where I'm from. And about 2 years later, I still worked with that healthcare system. We started to build new systems around suicide prevention. And then it was there that I realized that telling my sister story about her being a nurse and that she had died by suicide really helped people open their eyes up to say, oh, this could be anyone.
Could be anyone, right.
So that became part of my personal mission, and then I just found also ways it helped me heal.
Right.
And so I moved to California after taking some bigger jobs as COO and CEO with some of these big companies, wanting to be in a position that I could do more.
Right.
But at the same time, I was also doing my own healing, trying to fix my own wounds of the grief and loss of my sister. The being angry. The idea of somebody who dies by suicide is you ended your life. I love you,
right,
and my love is not enough. But I'm angry at you too, because you're the person that killed the person that I love.
Right.
And so it's complicated grief in that regard. So and it's not something that you can normally talk about, right?
Yeah, I mean, there's a lot of kids out there that maybe that happened to their parents or brothers or sisters or so I mean, how did you deal with that, and what helped you the most?
My spiritual health, honestly, was important. I was a churchgoer and working in the ministry. That was fundamental for me. So lots of prayer, and I think we've got to do better, honestly, of integrating into all of our healing experiences, finding some spiritual connection, higher power, whatever. Actually going to therapy, and saying, this is my time, just as much as you set aside time to hey, well, I'm going to go and get my hair done or whatever it is, or I'm going to go to the gym.
Eat. I mean,
you go to eat. Your nutrition. I was like, I have to find a place to actually go and do emotional health, right? So that was my time for me to go and talk about the issues, because work didn't stop. I was still doing the same work.
Busy man.
And what I mean, it was the same kind of work, and I couldn't get away from it.
Right.
So it was that time that I found that if I go to therapy with a therapist that I trust, that's aligned with my values. I can talk about the things, talk about my pain, talk about the hurt, cry if I want to cry. And that was my time. Another thing that helped me heal was writing a book.
Okay.
Right. So I wrote a book called Healing the Impoverished Mind.
Okay.
Building Resilience Through Adversity. You can get it on Amazon. It's also an audiobook now too. But that helped me find a place that I could express my story and help me process better. So those were the key things for me: the spiritual health, finding a place that I could express, write it, going to therapy, talking it through consistently, telling my truth, and also getting a small community around me. Now, I had great coworkers too, so they knew my sister, they knew my story, so I felt cared for.
Right.
We don't heal in isolation. We're not built human beings that are supposed to be on an island somewhere by ourselves.
So I mean, I think just for everyone listening, that the things that I got from this is, it's not just one thing. There's not this one magic answer. It's actively being involved in that process, and including therapy, including working on yourself, including your spirituality. Whether you want to write a book or not, or if you're skilled enough to write a book, writing things down, writing down your emotions, writing down your feelings, not letting it just being trapped in your head. And I think that's the problem a lot of people have, is they get so trapped in their head. And, when you're alone and you're just with your own emotions and feelings, if you don't have an outlet for that, whether it's writing it down or getting the therapy or the spirituality, that connection, then who knows what's going to happen. Those could be the signs of another disaster. But at the end of the day, you found that all these things combined helped you move forward, and then also helped you relate to clients and help them survive these types of issues.
Absolutely. So, and now I'm even more so sharing with my team. And I can't say enough that expression is so important. So, like you said, the therapy, might be one vehicle, but there's other ways too. My first writing of it was writing down a poem. Right. Sometimes it's singing a song. Sometimes it's. I was talking with a vet the other day, and he said, "Man, I go to a mosh pit, and I just, that's his expression, right? Finding that place of relief, whether it's singing, dancing, writing, crying, whatever. Find the ways to tune your brain into different elements of expressing that pain,
right?
Because that's really what it is. If we just hold it back in, we just become hardened, and it becomes very difficult for us to connect and reconnect with ourselves and other people.
Right. I think one thing I wanted to touch on, because at Renewal, you guys have all different levels of care, but including IOP and OP, which are intensive outpatient, outpatient. At Ocean Rock, we have a virtual IOP program, an OP program for people who don't have the ability to go in or who prefer to have access at home. And but what I'd like to share here is that these types of programs, whether it's on-site or virtual or online, they give you that kind of multifaceted approach. So it includes things like behavioral health therapy and CBT and DBT and all that, but also a lot of people don't know what that is. There's experiential components, there's writing things, there's art. It's how do you do the things that you would do pragmatically, but with a therapeutic impact? And it's not just talk therapy. So I think a lot of people have a misconception of what treatment is. Treatment is a combination of talk therapy, but really more experiential therapy, because you're in an intensive situation where you can't just talk about it, right? You need help immediately, and you need to be able to get to a stable place where you can have that, more long-term therapy. And so can you share a little bit about just, what clients get and how a good program like you guys have and that we have can help somebody deal with whether it's addiction or mental health at these levels?
Yeah. No, I mean, it starts with, it honestly starts with your welcome,
right?
And making sure that you feel supported. Everybody coming into a healthcare system is going to feel anxious. Like think about the last time you were in a hospital. You don't feel good about that. You're going to be anxious because what happens there in hospitals, in any healthcare setting, you feel like you have to put down your own personal power. And it's a good treatment program of any kind is going to acknowledge the fact that I'm shifting my personal control over to you because I don't feel like I'm mastering it very well. And so that anxiety is tough. So the first thing you should do is like ask a lot of questions about the program before you go to it, to know what the expectations are. You good shop around a little bit, right? Get some recommendations. Go online, look at reviews. Do some investigation to kind of find out what it is you're going to be able to help to put you at ease. You do have a choice, and when you make that choice, trust the process, right? Because especially coming in addiction, just know that day 1, 2, or 3, you're probably going to want to leave. There's going to be some discomfort because you're moving out of your comfort zone, and that's where really growth begins. But the program you're talking to should be able to tell you, like, here's the first 5 days, what they're going to look like. Here's day 10, to give you some path and direction. So, working on the fundamentals of just, okay, let's get an assessment done, getting the background done, making sure they understand where you're coming from, what kind of background, what they're going to be dealing with, and then you should be getting some kind of plan in place with a team. Usually you have a case manager, maybe it's a therapist that you're going to be working with that can kind of go over you, what are the key things, and you should be able to say, these are the things I want to look at, and ask them, say, what else are you seeing that I'm not seeing, because some are coming blind, like that I need to be working on, right? And be a part of your recovery, be a part of your mental health program, and then go through the steps, go to the groups. You don't, I can't say that enough, like realize that
do the work.
You get out of it what you put into it. So open up, speak up. It's confidential, right? Your information is private. So this is your opportunity to share with a group of people who also is under that same model of privacy, to have a community that is going through something very similar to you. And you're going to learn, open up your mind, get out of your comfort zone, which feels, difficult, but you're in a safe place, a structured environment that is designed, like I said, to get into some of that deep emotional work. So use every part of your treatment plan, from the nursing team to the physician to the case manager to the therapist, those groups, those individual sessions. It's very timely. If you're in a residential setting, it's 24/7. Right, so just get ready to maybe let go of some of your freedoms, and get ready to have some structure, right? It's kind of like I'm going to go on my fitness program, and this is my new diet plan for 90 days, if you will. And if I do this, make the commitment, and I'm going to come out better on the other side. And just absolutely plan this. There's going to be some bumps along the way, but the challenge is that you can work through those bumps, just like in life, but now you're in a protected environment. Right.
No, I hear that, and I think that there was always kind of in the past, right? There was this idea that addiction was all about willpower, and it's like you just have to want it, And then recently we've been talking a lot about the disease of substance use disorder, mental health disorders, and that is a reality. These are diseases, and these are medical issues, and there needs to be, medication, and there needs to be therapy, and there needs to be all kinds of different approaches. But I think from my experience, and based on what you're sharing with me, I think it's a combination. You have to acknowledge as a staff and as a society that there shouldn't be stigma, and we should be able to talk about mental health, and it's not a weakness. But at the same time, the individuals and the families dealing with this and going through this can't just use that as an excuse. You still have to do the work. You still have to hold yourself accountable and look yourself in the mirror. So, and I think that's the balance that we need to find as both a society, families and individuals, and in our field, because obviously in our field too, we have staff who they've gone through this, and they've made it, and they've survived, and they're in sustainable recovery, and they sometimes you forget a few years ago when you were in the trenches, right? And it's just reminding yourself that, hey, this is, I was there. Let's be compassionate.
Absolutely, that compassion is key. And we talk about recharging the workforce to make sure that we're not fatigued. But again, I back to your other point about stigma. If I had a magic wand, I wish that I could undo this stigma that we've created around a diagnosis of any sort when it comes to mental health. A good friend of mine likes to just say brain pain. And because when I say, nobody wants to be called mental, it just automatically creates this black mark of okay, this is so negative. The truth is, if you have chest pain, I'm gonna go to the hospital, nobody's gonna criticize you because I have chest pain. Now if I have brain pain, same time I have emotional hurt, whatever it is going on, maybe I'm hearing voices even, to not be ashamed of something is wrong. I don't feel well mentally, emotionally, and I need help. And then usually where the sticking points is like, I don't want to ask for the help because I don't want to deal with the shame, including in addiction. Like, I don't want to say that I have this problem because of the negative label.
Right.
And that's why it's so important to look at it as a disease, like you
Right.
said,
Right.
that these are diseases that are treatable. And there is good treatment out there, and there's a lot of people who have found recovery, are in recovery, whether it's from mental health or from addiction, just as much as somebody who has cancer. They get good treatment, they have treatment options, and they are in remission.
Right.
Right. So nobody's
Right.
going to, if we just take that stigma out of the equation, hopefully we can help people cross that line to say, you know what, I'm going to go get help.
Right.
I'm going to get my brain better. Right. Sleep, nutrition. All those kind of things, exercise, these things are good for my brain. And then learning your coping skills to make sure your brain is healthy, right? And that's really the idea of what these programs are, to help you become your healthiest emotional brain self, right? Mind, body, spirit, all of that.
Right. No, I love that. And I love just, brain pain, right? It's, there's all this debate about, well, substance abuse, abuse is a bad word. So let's say disorder, but substance use disorder, well, I don't know. Disorder doesn't sound great to me.
Right.
Can we say addiction? Can we not? At the end of the day, they call it a heart attack, right? They don't call it a degenerative heart disorder, right? I mean, it's because it's something that's shocking.
Yeah.
It's something that could kill you, and it's just something that's serious. So, I think less time spent on debating words and semantics, and more time focusing on the actual healing, and the actual compassion and love. I mean, I know it sounds cheesy, but it doesn't matter sometimes the word you use, it matters how you say that word, right?
Yeah.
I mean, you see that a lot with kids, right? You can say the nicest thing to a baby and you do it with a mean face and they think that you're awful, right? And you can say the worst thing to them and you say it with a smile and hugging them. They don't speak, they don't speak yet, but it's the way you come across.
Absolutely.
And not always the words. But obviously words are important and we need to be mindful of that.
Yeah.
But yeah, I think sometimes we lose track of.
I agree. Where we focus on it, it's just the idea is, like you said, these words and labels sometimes get in the way.
Right.
I've talks with with veterans, and they don't like PTSD, post traumatic stress disorder, and so we want to say post traumatic stress injury. So it's a softer term because okay, I can deal with an injury, but if I call you disorder, it's like no, I was injured, right, because of what I experienced, what I saw was traumatic, and that's an injury that needs repair and recovery. And in some cases, you can come back stronger. If you break your leg or, you need to have it set, right? You don't walk around, right? And it's like, look at my arm disorder. It's like, no, my arm was injured, right? And so I'm going to go get treatment for this, right? No big deal. Like this is what, it was a traumatic event, right? Or traumatic events that I experienced over a period of time.
Put the cast on and,
put the cast
take
on.
the time.
Take the time you need to recover. Do my work. Do my PT. Yes, it's uncomfortable.
Right.
But I'm going to get back, and I'm going to go back, and I'm going to work, and I'm going to be stronger. I'll jump higher, whatever the case is, right? And maybe I'm going to be even more insightful and have more lessons to give after the fact.
Put the cast on the brain.
There you go.
Put the cast on the brain.
Give it time. Yeah.
No, that's great. We talked earlier about men's health specifically, and last week I had a great speaker, Gina Tabrizi. And we all know her, and she talked about her own stories and everything, and we learned a lot from her. And although she wasn't specifically focusing on women, I mean, she kind of had a lot of good information out there. Now, for you, the things I want to ask you as somebody who's curious is, it's things that have changed for men. Whether it's the Me Too movement or just women have become a lot more involved in a lot of different fields. And the reality is, while women have fought for equality and they've worked hard to get to where they are, there's still a lot of fear and shame in men who feel like they've lost something, right? And we don't talk about it a lot, and that's not really the purpose of this show. But, for men specifically dealing with mental health and addiction, what are some things that you can tell them? And also for the women who are sitting at home with husbands or boyfriends or fathers or sons who have these things, because there is sometimes something lost in translation, and maybe you're the whisperer who needs to make that connection.
No, thank you. And again, you're right. First and foremost, shout out to Gina Tabrizi. Love her. She's my sister. And I must say, there's more work still needs to be done for women, and I'm grateful for the women finding their voice and finding spaces in leadership. We've seen them, come in as veterans and
Right.
working in STEM professions and things like that, and still more work needs to be done. Men, we've got work to do. And these outcomes about the suicide rates, our health and disparities among men who are dying younger, higher suicide rates. We probably outnumber men or women in addiction programs about 4 to 1 sometimes.
Okay. Wow.
We're using a lot of drugs and alcohol to cover up our emotional pain, right? And even if we're not suicidal, we're trying to numb it out because we haven't been taught as men or boys becoming men how to deal with emotion well, how to express it. And the best dynamic I can compare it is this is, if I were to look at like just 3 basic emotions, you have happiness and joy, that's one thing. Sadness is over here and anger is over here. And is what you're expressing congruent with the situation? So if something wonderful, happy, I can smile, but if something sad and tragic happens, I should be crying, I should be sorrowful. If an injustice happens and somebody's offensive or there's an attack, and I'm going to be angry about that, right? So before, women many times were not allowed to express like specifically anger, right? So, but now we're seeing women in aggressive modes. They're like in sports, they're being aggressive. We see women in these roles of being joyful, of being sorrowful without being judged about it, and also being angry. Men, we have not learned or seen good role models. We haven't seen that rite of passage of what it shows up to be like to be sad.
Right.
Because what do we say if men cry, right? You're weak. If you're vulnerable, you're weak. You don't talk to your woman about your vulnerabilities and all that other kind of stuff.
Right.
We have to show it. We have to be men. We have to be strong. And if I do talk about my emotions or my sadness or my pain, that somehow my masculinity is at risk, right? And even sometimes for some groups, especially among minority groups, even showing happiness. Like I remember growing up, like every picture, you don't smile. Right?
You gotta show you that you're
strong,
tough. Right?
You're tough. Every picture is like, you're tough. Like, I'm not going to show smiling because that looks weak.
Right.
So the only thing that I'm comfortable with is anger, right? And kind of this firm attitude.
That way they'll take you serious.
They'll take you serious.
Yeah,
So I'm going to be the man that's just that all the time.
Right.
And now that's getting labeled as maybe that's toxic. But the truth is that we're all human beings. We have all these real emotions.
Right.
But if I'm not allowed to express these appropriate, congruent emotions based on what's happened to me or based on how I'm feeling, then what happens is it starts to implode. So a man who is heartbroken, who loses his job, who goes through a divorce, who's separated from his children, who doesn't have friends anymore, right? Those men don't have a place to cry. They don't know like where to go.
Right.
So the anger turns inside. And then we have somebody who's struggling with alcohol and pain and suicidality, etc. And joy is not even on the table, right? So, and then when we get together as men, if I'm gonna go to my brother and our men, we don't know how to support each other, right? We'll say, well, let's, you're heartbroken, going through, well, let's go get drunk.
Right.
We say, let's go to the club.
Right.
Let's go have more sex.
Let's just find a way to take our mind off.
Take that, instead of expressing the emotion, we just numb it out. Let's find a way to get away from it.
Right.
Ultimately, you
still got to go back home at the end of the day.
To it. Yeah. And that's where the work for men needs to be done.
Right.
Is that we have to see real examples. Like I always kind of point out this meme. Remember Michael Jordan when he was crying, right? And we made fun of him. Right. Like it was a meme, the Michael Jordan meme. But Michael Jordan's like the greatest basketball player of all time. Yeah. But when we saw him crying, we made an absolute mockery of him. Right. And if you ever looked up to Jordan and you said, well, shoot, if they could do that to Jordan, what are they going to me if I cry?
But he used that emotion as power.
Exactly. But
I hear what you're saying.
Yeah. So we just have to be able to make sure that men have positive representation of being fully emotional and being able to create spaces for men to come in and express what they're going through, just because women have learned how to do this. Women, they go together, they talk about whatever it is, they express it, they feel it, right? However it looks like, they get to express that emotion. Men, we've struggled, and we have this friendship short of like, well, where are my brothers at?
Right. Who do you talk to?
Who do you talk to? So we need to find those few brothers that hold us accountable, that are counselors, that are comforters.
To be vulnerable, right?
To be vulnerable with, right? and allow us that space. Therapy can do that, but just having a group of men who are healthy, right? Who are you can look up to, who can create that space for you too. So those are my words I'd say about men's health and like what we need to do around it.
There's kind of two things I want to touch on based on what you said. One is, you're already an adult, right, as a man, and you're going through these things, right? And for whatever reason, the way you grew up, you had to hide those emotions. Right. I don't want to talk about it yet, but that's one of the things I want to talk about is how do you do that? Then the other one is more preventative, right? Because, in our fields, there's also adolescent programs, right? And there's programs for the younger kids, starting at 12, 13 years old. And so, working with people at a younger age, and more importantly, working with their families, to really kind of prevent that downward spiral, right? Because a lot of what happens later on is as a result of what happened earlier on. And it's not about blaming parents. I think a lot of times people get sidetracked about blaming parents, or I don't think anyone should be blamed. This is a group responsibility, right? I'm sure the kid did something to piss off the parent, and they're dealing with stuff, and they yelled, and that's all. To me, you don't judge that. But it's how do we come together, and how does the child be able to share those emotions and feelings, and how does the parent know when to entertain that and when to, kind of guide that and navigate that? Because the way I see it, a lot of parents, and I want to say fathers, but I'll just say both parents, they look at let's say they have a daughter and a son, right? They look at their daughter and they will say, okay, well, she's crying, she's sad, or she's emotional, and you go give her a hug and a kiss, and you kind of acknowledge that feeling, and you provide her with the compassion required to get over it. And then you see your son dealing with the same thing, and you say, well, unless you're hurt, like, are you physically hurt? Did you break your leg? Unless you're physically hurt, or unless something really bad happened to you, you shouldn't be crying. Don't cry because you're sad or because it's emotional. And then I think people get lost and confused about, well, sometimes kids are manipulative and they cry because they want something. And so it's so hard. Like, there's no manual, right? As a parent, is it because they're manipulative? Is it because they want something? Is it because they want attention? Are they really in pain? And you don't really know. Especially if you have a few kids, right? Because then they piggyback off each other. So I think what I'd like to talk a little bit, I'm a parent of 3, and I personally want to learn this, is how do you as a father and as a parent in general be able to decode these things in younger children and adolescents, and help them navigate these issues earlier on, so hopefully they don't become issues when they're adults.
Yeah, it's a great question, and I can probably answer both of these.
Got it.
Both of these questions. One about kind of working on yourself, and also working with your child. It's like you really have to, like if you're talking to your child, you have to really remember like where you're coming from. Like, what is their reaction bringing up for you first, right? To really check your awareness. Knowing that the way that you were raised can impact them, and the way that you interpret the emotional expression. Like, what is it doing for you? Because you're the adult, right? That's kind of the idea. Supposedly, you're the adult, but you remember that, okay, your parents don't always have it together. And right now, how seeing my son or my daughter crying or whatever they're expressing, how's it making me feel? And understanding that, let's talk about inner child.
Right.
So, listen, like, look at your child like your inner child. And what I mean is that child needs to be nurtured and cared for, because no matter what age we're at, okay, I don't care if you're like 35, 95, whatever, we all have an inner child being your emotional self, right? It's part of who you are. And you need to make sure that you nurture that emotional self, your inner child, the work that didn't get done. Because remember, when you were a kid, maybe your parents didn't show up. You got to forgive that. Like you said, you got to look past it. You don't know, it does no good to blame them and say you're supposed to. Now you're an adult. Work on your inner child. Do your work first to make sure that you're okay with judging and holding space for your own emotional pain and discomfort. Do that work first and foremost. That's the best thing you can do for your children. Right, is to know that you've been healed, that you can create a secure place when you feel uncomfortable, that we're not projecting stuff out on our kids.
Right.
Now, when we look at our kids, now they don't have all the tools. And sometimes they're looking to our parents. They think that you are the world. You
Right.
are the first role model,
Right.
of emotional regulation, of safety. So how you interact, and they are not sure. They're feeling feelings and expressing it how they express it. So if we try to gender and say, well, boys, you're not supposed to cry and it's okay if girls do, that's obviously part of the issue that I was talking about before. So we need to make sure that we don't place judgment on how the kid is expressing it, whether it's good or bad. It's just that they're expressing and they need something,
Right.
right? They're a child. So something is a need. Like I worked with, many families and, helping other parents figure out their kids, and they're suicidal. They're doing this for attention.
Right.
So then we think as parents, well, I'm going to ignore them. I was like, no. If somebody is showing you something that they need attention, pay the attention.
Right. Doesn't matter why.
It
Right?
doesn't matter why.
Right,
It
right.
doesn't matter what they're doing.
Right.
If once you figure out, become curious, what's going on? Are they hungry? Do they need to sleep? Do they, did they get hurt at school?
Maybe they just want to talk.
Maybe they want to talk to you. So because hey, listen, I see you crying. Acknowledge whatever that emotion is. I hear you're yelling. What's going on? Help me understand. Instead of judging it as saying it's either a good thing or a bad thing, especially when we say, well, it's good if a boy is crying, it's bad, and if a girl is crying, it's bad. Because remember, it's part of that dynamic where I'm talking about some girls will be angry, but because of this history where when women aren't allowed to be mad,
Right.
women just cry.
Right.
Right?
Right.
So you have to be watchful of those dynamics because
You
you
gotta
don't
be
want
mindful
that.
of
Yeah,
both.
yeah. Because it's like, okay, well, she's crying, but she's angry about stuff.
Right.
I was like, no, well, let's talk about just
Right.
being angry. What does angry look like? Let's talk about it. Say it,
Right.
yell it, whatever you need to do. That's how you teach your children to make sure that they're emotionally congruent. They're human beings, right? So if we get stuck in what they're supposed to express, we're starting this same cycle over again with our young people. So again, first working on yourself and your own emotional well-being, making sure how am I feeling this? Can I nurture my own feelings without judging them? Breathe, be mindful, calm my nervous system down, those kind of things. Speak positive things back to myself, say the right things, encouraging things. I'm lovable, I'm at peace, I deserve love, I deserve communication, I deserve to have a good time, right? I'm worthy. Those messages begin to play. Say that back to yourself because maybe you didn't hear them before. And then when you do have children or have an opportunity to talk to your children, speak those things. I love you. You're beautiful. Whatever you're going through, give them encouragement. Help them build self-esteem. That's the best thing that you can do because they're not always going to be around you.
Right.
So you want to make sure you protect them with emotional strength and emotional intelligence, which is not judging their emotions, but being able to speak up freely about how they feel. And if they don't know how to deal with something, to know that they can come to you, right? Otherwise, they won't,
Right.
right? Because they're worried about the judgment again.
They should be able to come to you, and then you should be able to go to them.
Absolutely.
And if there's some resistance, you don't just give up, but you're also there's that balance, right? You gotta help them open up because you tell them, hey, I'm not going to get mad at you, right? I think a lot of times they're worried that you're going to get mad at them or you're going to have some type of judgment, but letting them know that I just want to know what's going on. If I don't know what's going on, then I can't help you.
And share your emotions, share how it makes you feel. I think it's important. And, and I encourage people, even if you're trying to help a friend, just say, hey, listen, I'm concerned about you. Right. I care about you. I'm worried about you. I'm telling you how what you're doing is because there's a connection. I want to be present with you.
Just helping them speak up.
Exactly.
And I think going through your own examples, right? The other day I was with my kids and there was something going on in school and I said, look, when I was a kid, I would come home I would go in from PE and I'd be sweating and there's a fan right in front of me and, I didn't feel like I wanted to bother the teacher and let her know that that's bothering me, right? At some point I got sick and it was kind of really becoming a problem. And obviously over the course of time, I drew up the courage to talk to, and I'm a little kid, right? I don't remember first grade, second grade, right? But even at that age, I grew up the courage to talk to the teacher and say, hey, can you move that fan, right? But I should have been able to do that day one. It took me, a semester or whatever. But I used that example and I said, look, just go tell them. Go tell them privately. Don't do it in the front of the class. But sharing your own stories, it could be a stupid, just simple story like that, or it could be more meaningful and more heartfelt. But if they see, because they look at you as this guy, right? Like, no, not afraid of anything, can do this, can do that, the hero figure. But if you, and I think a lot of times parents fall into that trap of, well, I want to be this hero. But it's okay to show them that, hey, I am a strong person, but I'm also vulnerable.
Yes.
And this is how I go about it in order to be strong. And then they can learn from it.
Yeah, absolutely. And that's part of that vulnerability, that circling it back, even what we were talking about from the very beginning, is be human and own your mistakes. Be vulnerable, right?
Okay
and say, that's what you teach your children to say, I made a mistake, right? I was like, oh, wow, dad or mom said they made a mistake. Right, and they might try to play. It's like, hey, I made a mistake, but this is what we're going to do, right? So we're going to learn together. And hey, maybe you taught me something, so let's talk about that.
Right.
Those are important conversations that help them to really learn. Like, okay, mistakes happen, and we're not over ego, and we're not trying to pretend. Be authentic.
Right.
Which again, I think, coming back to the workplace, you want the same thing, right? I can't run around being hoity-toity like I got it all the time. I told my team, I'm sorry. It's like I didn't mean, I shouldn't have done that.
I do that all the time. Acknowledge my mistakes and try to create that culture, because the last thing I want to hear when someone makes a mistake, because when somebody makes a mistake, right? But it's, well, I didn't know this, or I didn't do that, or just trying to say, well, it was that guy or that department, or it's okay. If you're willing to acknowledge it and you're saying, hey, I want to learn and I want to get better, that's the type of employee you want, rather than the one who just wants to kind of shift the burden to somebody else.
Absolutely, absolutely. And for whatever family culture you're trying to set, whether it's work culture you're trying to set, I think you need to, sit with yourself and in your mind and think, how would I like things to be in my life? Right. And then ask the question, what do I need to do? How do I need to act every day to create those spaces in the work and when I come home? Right, I need to be authentic. I need to tell the truth. I need to own my mistakes. Like, oh, that sounds nice. I need to be grateful. I need the laugh. I need the play. Right. And then the next thing, if you're doing that and you're creating that at home and in the workplace, right, people will want to work with you, and people will want to be part of a healthy family. Right. But we have to unlearn some of these dynamics. We leave too many things hidden, and it's time that we make this shift. In people's lives, and it starts with us individually.
Thank you for that. I want you to just share a little bit about your book. Number one, you touched on it, but really, how was that and not just a book, but just how was the process of writing things down, and ultimately, how did that help you get through what you were going through? But also, what is in the book that the reader and the audience can learn, and why should they buy your book?
Yeah, thank you. Again, the book is called Healing the Impoverished Mind, and it's really understanding this concept of feeling like we don't have enough. And I tell kind of an intimate story of some powerful things that happened in my life and how I adapted, how I survived. And I use that for the reader to think about their own struggles, their own adversity, and paint them a model. So as you read the book, you're going to go on a journey. You might hear about my story, but you're going to be thinking about what you've been through. And the goal is building resiliency, right? And I give some formulas like how to build resiliency. So the book itself was an exercise of creating of building resiliency.
Right.
And so I paint a picture and I give you some tips on how to do that exercise, but it's going to be impactful. And the goal ultimately is for you to find deeper purpose and understand that we in life don't have just one purpose, that it can evolve, and purpose is plural. Right? We're different things to different people at different times in our life. And sometimes we find ourselves in these dark places. Right. That we don't see the light out of, right? But it's in those moments that if we do these things that are spelled out in the book about really going deeper and finding hope and renewed faith and finding those communities and going to therapy, whatever that expression looks like, you can emerge with renewed purpose, new life, even greater gifts than you had before. You just don't see them when you're in that
Right.
moment. It's a journey, and
Right.
so is life. So healing the impoverished mind is teaching the reader how to break out of first see the cycles, break out of those cycles, and reemerge with new gifts, clearer purpose. So you're going to be touched if you read the book. It's also an audio version. What's really special to me is my niece, my sister's daughter, who was there when she passed away, wrote a chapter in the book.
Wow.
And she wrote it when she was 14 years old.
Wow.
And I had her come back and record her voice over her chapter. And it's just a beautiful testimony.
Powerful, yeah.
And I wanted to do it for her because now she's an author, right?
There you go. Yeah.
And I'm so excited for her because she's gonna have a child here soon. And the child's name is Amelia Rose, and my sister's birthday's next week.
Wow.
And so this is her granddaughter. So anyways, I'm excited for her. She actually just called me right before we started here today. But no, the book, again, Healing the Impoverished Mind, Building Resilience Through Adversity, is really about transformation and breaking some of those cycles so that you can find deeper purpose and meaning. And I reveal some of the, things that we encounter in healthcare and how to navigate that.
Got it.
And kind of push through some of those barriers. So, and that's what, part of my purpose is continue in my positions from my experience, from the leadership, as a practitioner, is to put all that together and work with the teams that I'm a part of to help me continue to grow, to create these systems where people can come in and feel safe and cared for. That's really what it's all about. Mm-hmm.
Well, I appreciate you coming on the show. Unless there's anything else you want to talk about, I feel like we really hit a lot of really deep topics. And, I'm just so grateful for you to spend the time with us today and the vulnerability to share this information with the purpose of helping people is just, something that we can't take for granted.
We can't, and that's one of the things that I would stress too is I've learned that when we understand purpose is not our own. It is a gift to give to other people. And when we really advance in understanding that having it and then giving it as a gift to other people is really what your purpose about, because that becomes your legacy. Whether it's your children, whoever you come encounter in contact with, your purpose is to help that next purpose. And the clearer you have that, the better off you can do to help other people. I will say this too, that just to kind of underscore about safety. If you are concerned about someone, if you're having thoughts that you don't want to live anymore, right? If you're in that dark place and you're not sure where to go, reach out for help. You can call 988, reach out to a friend that you trust. If you're seeing someone that you are concerned about changes in their mood, they seem depressed, they start using drugs and alcohol, right? They start talking about, I just feel trapped, things are not going to get better. They may be in that dark place. They start withdrawing. They say, you know what, sometimes I don't want to wake up anymore. Ask them the question. Ask them, have you been thinking about wanting to end your life? Have you been thinking about that you don't want to be here anymore? Those are key questions. Just if you ask somebody about suicide or suicidal thoughts, it does not mean that they're going to do it.
Right.
It won't plant the seed.
Right.
In fact, you just being an olive branch to say, I see you in that dark place right now and I'm concerned about you. Let's talk about it. That can be hard to do. But go with that person, be with that person, bring in 2 or 3 other people to say, who else can be on this journey with you to bring you out of this dark place, because your life is valuable and you are here for a purpose. Even though you can't see it right now, I'm willing to sit with you and do everything that I can that's in my power. And if I don't know anymore, I'm going to call, a treatment center or whatever it is, whatever help that you need.
Intervention, right.
Some kind of intervention. Just know that somebody needs rescuing. And because it's really hard to rescue yourself.
Right.
So if somebody that you're concerned about, ask the question. Just ask the question, and they might get angry at you.
Right.
They actually might get upset with you,
Right.
but that's okay to say, hey, I know you might be mad about this, but I'm concerned about you right now, and I want to make sure that you're okay. So, and if you don't want to talk about it right now, just know I'm here. So have those conversations.
And I think, don't give up.
Yeah.
And I think some people think, well, this is so deep and maybe they need some time. And the last thing they need in that moment is time, right?
Yeah.
They, as long as you can hear from them, even if they're yelling at you and cussing you out, the fact that they're talking to you means they're alive, right?
Yeah.
And the second you think, okay, well, I don't want to deal with this anymore, or let's just let them,
Yeah.
kind of take some time with this and they'll come back. That's when all of a sudden, a week later, the suicide or whatever. And it's
Yeah.
not every time, but it's just don't give up.
Yeah.
It's any type of conversation is fine, right?
Yeah.
It doesn't matter if it's rosy or not.
Yeah.
Right? But no, that's great. I think that, and then the number, was it 988?
988.
Just such a simple number,
Yep.
911, 988.
Yep.
For mental health.
Yeah.
988 for mental health suicide.
It's free. It's confidential. And again, even if you're concerned about helping somebody, just call yourself. Try it.
Right.
Just do it.
see what
You say
happens,
it into your phone. Hey Siri, I don't feel like I want to be alive anymore. Siri will ask you.
There's no fees.
There's no fees, nothing
Right.
like that. It's
Right.
not like 911 where there's scary emergency and all that other kind of stuff. It is really intended to be a help and support line. So
That's
use
great.
it if you're trying to help someone. If you need help, go ahead and call it. Yeah, I mean, it's really, again, all these systems are in place for us to get help, and so that people have better access to care, because, we're losing too many people
Right.
with purpose in our life. And again, if you're struggling, call, get resources. There's all kinds of support groups out there too, because I know that people are in different places of their journey. Talk about it if you've lost somebody to suicide. Or even to overdose, which is common too. Get some support
Right.
groups too for you, so that you can become resilient and really develop a better place and purpose. It'll deepen for who you are, and you'll realize your story, like mine, can help other people.
Well, thank you, Dr. Rollins. Not only have you been helping people, but shown your own resiliency,
Thank you.
overcoming this tragedy and working on helping other people overcome it. So thank you, and appreciate you.
Thank you. Thanks for having me. Thank you so much.